And from that, we gleaned three key insights. So we looked at academic and medical and published academic research on this topic. We looked at the experiences of people who have lived through perinatal distress, and we looked at the expertise of community-led and kaupapa Māori service providers and organisations, clinicians, midwives, doctors who have a lot of interface with communities. And together from those sources, we put together this research. So the first insight is really that actually, if we get this right, it could be very transformational for our whānau and communities. Perinatal distress causes huge suffering for parents. It can have lifelong implications for babies, both through that biological transfer I talked about before of the stress response in the body during pregnancy, but also after birth in terms of the impact it can have on parents' communication with their babies, with their ability to bond effectively, with parent-child attachment, mood, how likely parents are to read and sing and speak to their babies. All of these things can be made more difficult by perinatal distress in the family, and the combined result can essentially lock an intergenerational disadvantage for that family. When we're talking about the perinatal period, we're talking about the period from pregnancy until the baby's first birthday, except when we talk about suicide statistics, when the cutoff point for what is thought of as the perinatal period in those statistics is 6 weeks post-birth. So the key takeaway from that insight really is that the combined impacts of these things are very significant, but that responsibility should not sit with the individual, but the causes are systemic and so are the solutions. And that leads us into insight 2, which is that this is very widespread, it's complex, and it is systemic in our society. So up to half of new parents actually are thought to experience symptoms of depression or anxiety. The data is not very good. We don't collect very robust data on this, but when we combine the estimates of those who are thought to meet the clinical definition of those conditions with those who are thought to experience symptoms that don't quite meet the clinical threshold, but nevertheless are still quite significant and can have an impairing effect in their lives. When we put those two estimates together, almost 50% of new parents are thought to experience some form of perinatal distress. So that's a lot of parents doing it tough. It really can affect anybody, but there are some groups who are at greater risk, and they include Māori, Pacific and Asian women. So you can see perhaps why we have some of the panelists that we have here today. All three of those groups are thought to be at greater risk, as well as disabled parents, LGBTQI plus whānau, very young parents for whom the pregnancy is unexpected, and where there are the presence of other forms of systemic disadvantage, including violence, low income, poor housing, food insecurity. All of these things interact to create very challenging situations for many families. The third insight is that the right support at the right time is really the key to unlocking this problem. So what that support actually is and looks like will be different for every family, because it's very individual to what someone will need at a particular time. But whatever form it takes, having access to it and knowing that you have access to support and knowing that there's someone who could help you if you needed it, is the key protective factor for perinatal and maternal mental health. It works best when it comes from a source that parents already know and trust, which is why it's so important to support community-led, kaupapa Māori, culturally appropriate services. And when it's available, that early support can largely prevent the need to access more specialist treatment, because it can sort of stop the cycle of worsening mental health early on. But if things do get very bad, if someone does become very unwell, at the moment, it's very difficult to access specialist perinatal mental health support. It's inadequate, it's uneven, and according to the DHBs, in their own estimation, may not be equitable in its delivery. So we have quite a big challenge that we need to face.